You are listening to part 57 of our series, 7 Medicines, The Wise Woman Way, with Susan Wade at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Hi, Gemini. It's always a delight to be with you. I'm really enjoying these shows on the 7 medicines, and at the beginning of each month, I like to remind us that that is what we're doing so we don't get ourselves too immersed in one river and think that it's the only river there is. Although I will admit that the river with drugs is a big river, and we're spending quite a bit of time in the 6th medicine, pharmacological medicine, use drugs. And one of the things that we haven't talked about very much is that for me, I include most things that people would think of as supplements as drugs as well, and over-the-counter things as drugs as well. So what we've been doing so far is really looking at specific types of drugs like antibiotics, and then looking at the problems with those drugs, and then looking at what herbal medicine, because I'm an herbalist, offers instead. So we've looked at antibiotics and herbal antibiotics. We've looked at antivirals, antiviral vaccines. We've looked at herbal antivirals. We've looked at painkillers, and we've looked at herbal painkillers. And we've looked at blood pressure drugs and herbs that lower blood pressure, and anti-cholesterol drugs, the statin drugs, and those herbs and foods especially, that can be used instead of those drugs. And this month we are continuing on looking into another enormous category of drugs, which is sedatives. And sedatives are some of the most widely prescribed medicines. They would include both drugs that are used to tranquilize, so tranquilizers, as well as what herbalists would call outright sedatives. And herbalists would make a difference between these. A sedative would usually be soporific. It would usually put us to sleep, or even hypnotic, which is a sedative that basically knocks you out. Tranquilizing sedatives, especially among the herbal sedatives, are ones that are usually called nervines, and nervines actually improve the functioning of the nervous system. So a lot of herbs and a lot of drugs in these overlapping categories of sedatives, tranquilizers, sleep-inducing drugs, and anti-anxiety drugs. And they, especially among the herbs, run along a spectrum. But it's not just that there's lots of herbs. There are lots and lots and lots of drugs in these categories as well. And the side effects of those drugs are from the mildest, which is impairment of memory, impairment of judgment, inability to coordinate. In fact, many sources say that people who are taking sedative or tranquilizing drugs will often act like they are mildly drunk. They have the same slurred speech, the same kind of languidness in their body that almost looks like a fatigue, where they can just kind of slump down and stay without seemingly moving for a while, which then moves into paranoia, irritability, suicidal ideation, agitation, aggression. And in case you're thinking, oh, well, these are rare things, they're not. In fact, one of the most important things to remember about sedative drugs is they are almost always going to cause addiction. You can quickly develop a tolerance to these drugs even when you use it as directed. And what a tolerance means is that you take the drug for a certain effect it's going to have. It's going to help you get to sleep. It's going to help you calm down. It's going to help you when you feel anxious, whatever the effect that you're looking for. And you begin to not get the same effect from the drug, and so you want to take more of the drug, or you take doses more frequently in order to get the same kind of results. The ability to be addicted to sedative drugs increases as we age and is stronger in women. And unfortunately, what we see is that when we look at who gets prescribed sedative drugs, sleep-inducing drugs, anti-anxiety drugs, tranquilizers, it is far more women than men and far more older people than younger people. So we begin to see that the very people who are going to have the worst problems are the people who are most likely to be prescribed these drugs. One of the types of sedative drugs that is prescribed is benzodiazepines. And benzodiazepines are tranquilizers, sleep-inducing drugs that Public Citizen, the publishers of Worst Pills, Best Pills, says do not use. Do not use this class of compounds for sleep problems, not just because of all the side effects that I've mentioned and the great possibility of addiction, but because there is a very strong connection between the use of these drugs and Alzheimer's. So what are we talking about? Benzodiazepines include drugs like Xanax, Nirvanam, Onfil, Klonopin, Traxine, Librium, Valium, Diastat, Ativan, Halcyon, Restoril, and of course the infamous Rohypnol, which is the date rape drug. These have some mouthful names: alprazolam, clobazam, clonazepam, clorazepate, chlordiazepoxide, diazepam, astalzolam, lorazepam, triazolam, tempazepam, and fluitrazepam. That's rohypnol there. And it's interesting that all of these drug names have Z's in them because they are gradually being replaced by drugs that are called the Z drugs, which also have Z's in their names. So I'm like, the Z's, however, in the Z drugs come at the beginning, so I should not get confused about that. The benzodiazepines include adverse reactions such as compromised cognitive function, reduced mobility, impaired ability to drive, increased risk of falling and fractures, and Alzheimer's. The researchers found 51% increased risk of Alzheimer's in those who had used benzodiazepines at any time in the 6 years before their diagnosis of Alzheimer's. The risk increased with the number of daily doses taken over time. Those who took 91 to 180 doses had a 32% greater chance of being diagnosed with Alzheimer's. And those who took more than 180 doses had an 84% greater risk of being diagnosed with Alzheimer's. Now, let's listen very carefully to what they're saying, because they're not saying that your chance of getting Alzheimer's is 84%. They're saying that your risk increases by 84%. And if that risk is, and I don't know what it is, but let's give it a moderate risk of 2% a year, then that would bring that risk down, or move it up, but it would never actually make the risk to be that 84 out of 100 people would be diagnosed with Alzheimer's. It is a significant increase, however, and enough to give us all pause, and certainly enough for Public Citizen to list all benzodiazepines as do not use for sleep problems. Those who took a long-acting form of benzodiazepine had a 70% increased risk of Alzheimer's versus a 43% increase in risk for those who took the shorter-acting forms. 5% of all U.S. adults filled at least one prescription of benzodiazepines in a year, and 75 million prescriptions are done yearly in the United States, and these are figures that are over 5 years old. We know that the figures are going to be higher because more and more of them are prescribed. A recent study also found age-related increase in the number of people using these drugs long-term, which is 120 days before. About 31% of those aged 65 to 80 are taking or have been given a prescription for a benzodiazepine over the past 12 months. In all age groups, women are about twice as likely to receive a prescription for these drugs as men. I was quite amazed that Public Citizen was willing to come out so strongly against these common sedative drugs. They are, in fact, the most commonly prescribed sedative and sleep-inducing drugs in the United States, and that is a very strong stand to take. The article has a box with fairly big letters and a really big outline around it saying, "Do not use benzodiazepines." Wow. The drugs that the benzodiazepines replaced were barbiturates. And we're all familiar with barbiturates. As a matter of fact, barbiturates, because of the risk of addiction and abuse, are drugs that we are trying to phase out. A rather amusing little list that I found was some of the street names of barbiturates, because they are sold on the street. Redbirds, Barbs, Blue Devils, Downers, Red Devils, Bluebirds, Rainbows, Nembutal, Seconal, Phenobarbital, Tuniol, Tuies, Yellow Jackets, Phenes, and Amytal. And so barbiturates and older sedatives are classified as being central nervous system depressants. They are primarily used at this point as anesthetics and as anticonvulsant medications. Interestingly enough, it is not as easy to become addicted to barbiturates as it is to become addicted to the benzodiazepines. And that kind of made me scratch my head about that. Certainly, I understand that the barbiturates are abused, but it looks like the benzodiazepines are just as much being abused. The fact that they don't have a whole bunch of street names is probably just my ignorance. I'm sure out there on the street they do. Barbiturates can give anesthesia within a minute. Methohexatol, thymil, and thiopental, pentothal. Many of us have been given these drugs in an inpatient or an outpatient situation. Short and intermediate acting barbiturates are the drugs of choice out on the street, including amobarbital, pentobarbital, secobarbital, butylbitol, and butabarbital, known as amytal, nembutal, seconal, thioronol, and butasol. And it was interesting that I found that frequently that barbiturates are combined in a pill with acetaminophen or with aspirin or aspirin and caffeine. The thioronol is a barbiturate, aspirin, and caffeine. So we talked about this when we talked about the antihypertension drugs, that frequently a person will say, I'm just taking one drug because they're just taking one pill, but it turns out that that one pill has several different kinds of drugs in it. You might think, why on earth would caffeine be added to something that's supposed to be a sedative? And that's because that little bit of salt in the pie makes it taste all the sweeter. There are also long-acting barbiturates, and they have far less ways in which they're used because it can take them up to an hour before you feel any sedative effect from them, including phenobarbital and methobarbital, which is luminol and mebarbital. The Z drugs, which I mentioned before, are the newer class of drugs. They have about the same problems as the benzodiazepines, but they have even worse problems as well. They include zolpidem, zopiclone, azopiclone, and zalaflon. They are Stilnoct, Ambien, Intermezzo, Stilnox, Imovane, Zimovane, Imrest, Lunesta, Sonata, Starnock, and Adante. You've heard some of these names on your television. And these Z drugs have a shorter duration of action. They are in the body for a shorter amount of time, and they don't disturb the what's called the sleep architecture, or the way we sleep, and they're less likely to cause hangover the next day. But adverse effects include hallucinations and psychosis, bizarre and strange behavior. In fact, the Food and Drug Administration has issued regulatory warnings and restrictions about the Z drugs because of these psychotic, hallucinatory, bizarre behavioral effects that can occur. Again, all of these drugs can have these effects when they are taken exactly as prescribed. You don't have to be abusing these sedatives to have these kinds of effects. Now, you can worsen the effects if you are taking any kind of anti-anxiety drug and you take an antihistamine. You are pushing on what's happening with that sedative drug. And we'll talk a little more about that in next couple of months when we talk about antihistamines and what's going on with the drug antihistamines. In addition, even a small amount of beer, wine, or hard liquor in combination with these sedatives is going to cause an unexpectedly severe reaction, especially in the early times of taking these. So we've been talking about, what happens, what goes wrong when things are going right, but there are obviously times when things are going wrong too. Patients will misuse sedatives to self-medicate, and this has become a bigger and bigger problem. As a matter of fact, there are courses now for doctors in trying to figure out which patients are really needing the sedatives and which are actually using them in a way that the doctor perhaps wouldn't necessarily want them to continue because of the very real risk of addiction. Of course, when sedatives are overused, they can cause euphoria. And the overdose, the difference between a dose that gives you the sedative or sleep-inducing effect that you want, a dose that gives you euphoria, which is a little more, and a dose that can lead to coma is just a little more. So I was not surprised to find that there are deaths associated with the use of drug sedatives in the United States. We mentioned that a person who has taken too much of a sedative drug is going to have kind of the symptoms of being drunk, slurred speech, staggering. Also, they will have dilated pupils, trembling hands, and a very weak pulse. They will probably be confused and disoriented, and they may swing from emotional highs to lows. One of the things that catches people unaware is that sedatives don't always wear off when people think they are supposed to, especially as you move deeper into taking them and deeper into an addiction that you may not even realize is there, so that the ordinary day-to-day life and our ordinary work life can be dramatically and negatively impacted by taking drug sedatives and drugs that induce sleep. Another type of drug that is a sedative that is used is chloral hydrate. In fact, in a recent study asking people what kind of sleep aids they were using, the ones that they mentioned most often were butalbital, chloral hydrate, estazolam, esopiclone, flurazepam, quazepam, ramelteon, temazepam, trialzolam, zaleflon, and zolpidem. They also included in their study antidepressant drugs with sedative functions. The FDA has not approved these as primary medications for insomnia, but their sedative effects make them very frequently prescribed for patients who have both depression and sleep disorder. And that includes amitriptyline, doxepin, mirtazapine, and trazodone. Let's look at chloral hydrate. I was a little surprised that chloral hydrate was still in use. I think of it as kind of an old drug, and in fact, it is one of the old drugs, and one of the things that Public Citizen reminds us is that often the old drugs are going to be a lot safer and have a lot less side effects than the newer drugs. Chloral hydrate is used for treating sleep disorders, but it's also used to prevent the symptoms of alcohol withdrawal and even to treat existing withdrawal symptoms. And I thought, I wonder how many of the people who are reporting that they're using chloral hydrate are using it because they got addicted to the benzodiazepine that they were on and were switched to the chloral hydrate to help them come down off that. I'll be reading a little more to you about what happens in an addictive state with these drugs. And chloral hydrate is considered a non-barbiturate sedative and hypnotic, which works by depressing the brain, the central nervous system. That means you feel drowsy. One of the great things about chloral hydrate is it's far less likely to cause that slowed breathing rate than the barbiturate-type sedatives and hypnotics. Chloral hydrate is also used in hospitals to produce sedation before certain procedures or to relieve anxiety due to certain procedures, and is used for substance withdrawal. So if you are taking a benzodiazepine, you might want to ask your doctor about chloral hydrate and segue from the more addictive drug to the less addictive one, and then from there to the herbs. We will see when we're talking about herbs that most of these herbs are actually going to interface quite well with these drugs, although, of course, there is always the usual thing, and it says, be careful if you're using any of these sedative drugs. Be careful if you're allergic to any ingredient in them. Be careful if you have liver problems or kidney problems, if you have heart problems or severe inflammation of the stomach. And for each one of these drugs, of course, there's a long list of other drugs that you should not take. With chloral hydrate, you should not take barbiturates, loop diuretics, or anticoagulants. And there are so many people, especially people over the age of 65, who are taking anticoagulants and loop diuretics, that we begin to see why chloral hydrate, although it has a lot to offer, is probably not used as much as it should be. As with any of these sedative drugs, they are not recommended if you're pregnant, planning to become pregnant, or breastfeeding. They are not designed to interface with dietary supplements, herbal supplements, or any other non-prescription medication that you might be taking. These sedative, hypnotic, and tranquilizing drugs can be difficult to deal with if you already have allergies to certain medicines or certain foods. And by that, we really mean an allergy, not a sensitivity, but an allergy. In other words, a reaction that could cause your death. If you have inflammation anywhere in your body, and so far as I know, most people do, then these classes of drugs are probably going to aggravate that. Also, if you have a history of depression, suicidal thoughts, substance abuse, or dependence, then sedative drugs are going to be quite problematic for you. This certainly does not stop doctors from prescribing them to millions and millions of people. The number of admissions to addiction treatment programs for sedative abuse grows year after year. The easy start often winds up with intoxication, addiction, and withdrawal syndrome. There are drugs that can really deal with the potential adverse effects, but it's very strongly advised that if you are taking sedative drugs, that you do not stop, that you come off of them very, very slowly. Withdrawal syndrome can be avoided by slowly tapering down the dose of the sedative over several weeks. And it is far better to taper off gradually than to do a withdrawal that could result in convulsions, delirium, and death. Sedative drugs can cause serious withdrawal problems that have to be treated by other sedatives in close medical supervision. Narconon is the center for those who are addicted to sedatives, and it offers a drugless recovery from the sedative addiction. Narconon. We're going to be talking about some herbs that you can use, and you can use these herbs at any time as you're withdrawing. After you've finished a treatment program, most of these herbs are completely safe, and improve the functioning of the nervous system, and of course help you to feel well enough that you don't need to relapse into taking sedative drugs. I'll talk to you next week.
Thank you so much, Susan. And this concludes part 57 of our series, The 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio.